with another lecture which is organized by Maharashtra University of Health Sciences, Nasik. Once again, I thanks our Dean, Dr. Bagal sir, and our principal, Dr. Evo Dahad sir. Our today's topic is regulation of blood sugar level. Many of the time they have asked the short note blood sugar level. That means here what is expected is to write about the regulation of blood sugar level. At the end of lecture, all the students should know what is normal blood sugar level, what are the factors which are regulating blood sugar level, and how the blood sugar is kept in normal range so that very important function is transport. Blood transport many substances from one place to another. It acts as a vehicle, as you know very well. It carries many substances from one tissue to another. These substances especially include nutrients. Whatever food we are taking, having nutrients, and these nutrients will carry from the what you say intestine to the blood, and through the blood it will reach to cells and the tissues. The main source of the entry of glucose out of this, the glucose is very much important for the energy purpose, and here we are talking about the regulation of blood glucose level, blood sugar level. So the main source of entry of glucose into blood are dietary carbohydrate, glycogenolysis, and glyconeogenesis. Participant, please unmute yourself. Main source of entry of glucose in the blood is through carbohydrate, glycogenolysis, and glyconeogenesis. Please unmute yourself. Please mute yourself. Sorry, please mute yourself. So what I was talking, the glucose is very much important for the energy purpose, and how is to be maintained that we are studying. The main source of entry of glucose into blood are dietary carbohydrate, glycogenolysis, and glyconeogenesis. Out of the diet, out of the food, carbohydrates are the most abundant constituent of our diet. Majority of the food which we are taking having carbohydrate. These carbohydrates get hydrolyzed, get break down into glucose, fructose, galactose in the alimentary canal or in the alimentary tract in the GIT. So by the GIT, carbohydrate get hydrolyzed, get break down with the help of different digestive juices into glucose, fructose, and galactose. Once we get glucose, this glucose is get transported. This glucose is get transported to liver by portal circulation. Then the fructose and galactose which are there are converted into glucose in the liver. So what I mean to say that जो भी हम खाना खाते हैं is having maximum amount is carbohydrate. That carbohydrate get hydrolyzed into glucose, fructose, galactose in the GI tract. This glucose or sugar is transported to liver by the portal circulation, and fructose and galactose will again get converted into glucose in the liver. And by the process of glycogenolysis, lysis is breakdown, glyco is glucose. So by the process of glycogenolysis in the liver, free glucose which is released in the blood, the glucose which has been produced as a result of carbohydrate metabolism, as a result of digestion of carbohydrate, we got the glucose. Glucose from the intestine get absorbed in the blood, and through the blood it has been reached to the liver, and in the liver we get the free glucose. This free glucose from the liver get released into the blood. Liver and kidneys can form glucose by the process called as gluconeogenesis, which is released into the blood. So there are two ways what I have told you. Whatever food we are taking is having carbohydrate, and that carbohydrate get breakdown into glucose. Glucose from the intestine get absorbed in the blood, and through blood it will go into liver, as well as in the liver it gets stored, and from the stored glucose again glucose will form by the process of gluconeogenesis. So there are two processes by which we get the glucose, that is glucogenolysis in the liver will occur, and glucose will get breakdown, and we will get the the glucose. As well as liver and kidneys can form the glucose by the gluconeogenesis process through which we get the glucose, and that glucose can get released into the blood. This glucose now is taken up from the blood. From the blood, this glucose will reach to various cells and the tissues. So this glucose will be taken up from the blood by the different tissues by the various processes. What are those processes? Those processes are: first is oxidation, second is glycogenesis, then lipogenesis, then synthesis of amino acids, and then synthesis of other compounds. So these are the process by which what we have got the glucose. This glucose will reach to cells and the tissues. Glucose will reach to cells and the tissues by the process of oxidation, glycogenesis, lipogenesis, synthesis of amino acids, and synthesis of other compounds. By this process, glucose will reach to cells and tissues. When there is oxidation process will occur via glycolysis and very well citric acid cycle. Through this, the glucose get breakdown. The glucose get breakdown, or you can say glucose get utilized. Glucose get metabolized. Glycolysis and citric acid cycles are the main source of energy in the most of the tissues. How we get the energy, how we get the ATP, unless and until glucose will go into the various metabolic process or the chemical process for that matter. Unless until glucose will go into various chemical process, we will not get the energy or we will not get the ATP. So how we will get the energy? The process of glycolysis and citric acid cycle, Krebs cycle. By the process of glycolysis and citric acid cycle, the glucose will go into the metabolism and we will get the glucose, we will get the energy, we will get the ATP. Some of the glucose is also get oxidized via HMP shunt and uronic acid pathway. And this glucose is again converted into glycogen and gets stored in many of the tissues. However, the capacity for storing of glycogen is limited. So just to sum up, अभी तक हमने क्या देखा? Just to sum up, whatever food we are taking having abundant carbohydrate, this carbohydrate get break down into glucose at the different junction in the GI tract. And these carbohydrates get break down into glucose, fructose, and galactose, and this glucose will get absorbed from the intestine into the blood. From the blood, it will go into the various cells and the tissues. How it will go is another topic. With the help of sodium co-transport mechanism, glucose will get absorbed from the intestine into the blood, and from the blood it will reach to cells and the tissues. Now, when it will go into cells and the tissues, it will go into the process of oxidation, and by the process of glycolysis and by the process of citric acid cycle, this glucose get metabolized and will get the energy, will get the ATP. The glucose which has been not get metabolized get converted into what we call as the glycogen, and this glycogen gets stored in the liver, and whenever there is a necessary, Whenever there is a necessary, this glycogen is again get break down and we will get the glucose. I hope you are getting my point. And now this glucose which has been get stored is having a limited capacity. Beyond that limited capacity, it cannot be stored. So in short क्या होता है, जो भी ग्लूकोज आया है सेल्स टिश्यूज ने यूटिलाइज किया है, ओवर अ पीरियड सेल्स और टिश्यूज की डिमांड खत्म होने के बाद में ग्लूकोज जो एक्स्ट्रा ग्लूकोज है, एक्सेस ग्लूकोज जो है वो ग्लाइकोजन में स्टोर होता है, लेकिन स्टोर की भी एक कैपेसिटी होती है बिसाइड दैट दैट ग्लूकोज कैन नॉट बी स्टोर्ड. अब ये ग्लूकोज जो स्टोर नहीं होता है, व्हाट विल हैपन विद दैट एक्सेस ग्लूकोज? दैट एक्सेस ग्लूकोज विल कम इनटू द ब्लड, isn't it? That excess glucose will come into the blood. So when availability of glucose is high, it is converted into lipids, and acetyl coenzyme A form from the glucose and get converted into fatty acids. Glycerol 3-phosphate is needed for esterification of fatty acid. So in short, एक बार ग्लूकोज सेल्स और टिश्यूज ने यूटिलाइज करने के बाद में एक्सेस ग्लूकोज जो है, दैट एक्सेस ग्लूकोज का डिमांड ज्यादा रहा तो वो लिपिड्स में कन्वर्ट होता है, या वो ग्लाइकोजन में स्टोर हो जाता है, या एसिटिल कोएंजाइम फॉर्म होके दैट एसिटिल कोएंजाइम ए विल गो इनटू द क्रेब्स साइकिल एंड दिस इज हाउ द ग्लूकोज गेट मेटाबोलाइज्ड. बट इफ इट इज नॉट so, that excess glucose will remain there into the blood. That excess glucose will remain there into the blood. Beside that, सिर्फ इससे ही नहीं तो this glucose is also coming through the lactose, ribose, mucopolysaccharides, glycolipids and glycoproteins. Through all these sources, glucose is coming into the blood. So continuously glucose is coming into the blood. In short, what I mean to say, the continuously glucose is coming into the blood. Similarly, same time, cells and the tissues are utilizing by the process of oxidation, by the process of citric acid cycle, and it is giving the ATP and energy to cells and the tissues. So glucose is coming and glucose is removing. This process is going on, but still, as I told you, if it is not, if the storage capacity के से ज्यादा ग्लूकोज तैयार हो रहा है और वो ग्लाइकोजन में स्टोर नहीं हो रहा है, then that excess glucose will remain into the blood, and these blood glucose concentration get increased in the blood, and it has to be kept into the narrow range, otherwise it is going to cause a problem. So blood glucose concentration is maintained within a narrow range after the, of course, after the absorption, after the requirement. So whenever there is decreased blood glucose level is called as hypoglycemia, and increased blood glucose level is called as a hyperglycemia. Both the conditions are harmful. Decreased blood glucose level is hypoglycemia and increased blood glucose level is hyperglycemia. Both hypo and hyperglycemia, these both the conditions are not good for the body, for the homeostasis mechanism of the body. Hypoglycemia can deprive the tissues, especially brain. Hypoglycemia can deprive the tissue, especially brain, and continuously brain is requiring the glucose, and when glucose is not what you say, the brain is not getting the glucose, then you will be having a various problem. So brain tissue continuously requiring the glucose. So if there is a hypoglycemia, that is going to deprive the tissues, especially of brain. When there is hyperglycemia, that is going to disturb osmotic balance, fluid and electrolyte balance, and acid-base balance of the body fluid. So in short, अगर ब्लड ग्लूकोज लेवल बढ़ती है या कम होती है, हाइपोग्लाइसीमिया हाइपरग्लाइसीमिया दोनों ही कंडीशन गलत है, that is going to cause some harm to the body. Therefore, one has to know about the regulatory mechanism. One has to know about the regulatory mechanism to maintain the blood glucose level within normal range. That's why one has to maintain hypoglycemia and hyperglycemia. Both the conditions are not good. That's why the regulatory mechanism is to be there to maintain the blood glucose level within normal range or within normal limit. So there are three important systems. This is very important point. यहाँ से actual regulation शुरू हो रहा है. यहाँ तक हमने अभी तक क्या देखा? How the glucose is coming into the blood and then it is going to cells and the tissues. How with the different sources glucose is coming into the blood and reaching to cells and the tissues, and how the carbohydrate get converted into glucose and get metabolized with the different processes. By the glycolysis, glyconeogenesis, glucose is forming, how it gets stored in the form of glycogen in the liver, and again glycogen get breakdown and we'll get the glucose. And it is satisfying the need of the cells and the tissues. After satisfying need of cells and the tissues, if glucose remains, that gets stored into the form of glycogen in the liver. But after the limit of that storage, that excess glucose will come into the blood and that causes the hyperglycemia, or opposite condition may occur called as a decreased blood glucose level, hyperglycemia. And this hypo and hyperglycemia, both the conditions are not good. And then body has to maintain the blood glucose level within the normal range so as to perform the functions of glucose, so as to get the proper energy. And that regulatory mechanism is maintaining the blood glucose level within normal range. And liver, kidney, endocrine system, these are the three important organs. Remember well, liver, kidney and endocrine system, these are the systems which are maintaining the blood glucose concentration. Liver, kidneys and endocrine system are maintaining blood glucose concentration. So first, as I told you, liver, kidney and endocrine system is playing a role in the regulatory mechanism of blood glucose level or blood sugar level for that matter. So blood sugar level is maintained by liver, kidney and endocrine system. How the liver is playing a role in maintaining blood glucose level? Though liver is playing a key organ of metabolism, as most of the metabolic pathway is operated through liver. Liver can take up the glucose and it can release the glucose anytime. Liver can take up the glucose and can release the glucose at any time. This uptake of glucose of the liver is depending upon the blood glucose level. Blood glucose level अगर ज़्यादा है, so that excess glucose will go to liver and that will get converted into glycogen and get stored. If it is less in the blood, that stored glucose from the liver get breakdown and will release into the blood. This is how liver is playing a role. I hope you are getting my point. This is how liver is playing a role. Liver is an important organ for metabolism of glucose because most of the metabolic pathway is operated through the liver. Anytime it can take up the glucose, it can release the glucose. Of course, that depending upon how much concentration of glucose in the blood. If it is excess, that excess will go to liver. If in the blood it is less, that glycogen get breakdown and will convert it into glucose and that will release into the blood. This is how liver can increase blood sugar level. It can decrease blood sugar level depending upon requirement. For example, or for that matter, when blood glucose level is increased, अगर blood glucose level ज़्यादा है, when blood glucose level increase, so hepatic uptake of glucose will increase. Right now I have told you, अगर blood glucose level ज़्यादा है, तो excess glucose जो है वो liver ले लेगा. Pathway which utilize this excess glucose is glycolysis, HMP pathway, glycogenesis, lipogenesis. All this will become active. All this pathway right now which I have told you through the liver that will initiated, and glycolysis, HMP pathway, glycogenesis, lipogenesis, through this that excess glucose will be taken up and get metabolized and will get the energy. So whenever there is an increased blood glucose level, liver will take the excess glucose, and the pathway by which that excess glucose will get utilized, that is by glycolysis, HMP pathway, glycogenesis, lipogenesis, and all these. Glycogenesis is glucose production genesis. Glycolysis is breakdown. Okay, so and even from non-carbohydrate sources like fat and proteins, we can get the glucose. That is glyconeogenesis. So these are the processes by which the liver can maintain the excess glucose, or it can increase the glucose in the blood. So that was, I have told you, when blood glucose level increase. फिर से बोलता हूँ, जब ब्लड ग्लूकोज लेवल बढ़ जाती है तो एक्सेस ग्लूकोज विल बी टेकन अप बाय द लीवर एंड गेट स्टोर्ड and get metabolized by the various pathways like glycolysis, HMP shunt, glycogenesis, lipogenesis. All these will become active when there is an increased blood glucose level. When there is decreased blood glucose level, this pathway which produces glucose, that is glycogenolysis and glyconeogenesis, become active. So when there is decreased glucose level, अगर ग्लूकोज लेवल कम हो जाती है तो ग्लाइकोजिनोलाइसिस एंड ग्लाइकोनियोजेनेसिस एक्टिव हो जाते हैं ताकि वी विल गेट द ग्लूकोज. रिमेंबर वेल, जब ब्लड ग्लूकोज लेवल बढ़ जाती है तो ग्लाइकोलाइसिस होता है, ग्लाइकोजेनेसिस होता है. Two pathway will get operated. When there is increased blood glucose level, two pathway get operated, glycolysis and glycogenesis. Okay, and when there is decreased blood glucose level where we require the glucose, in that case glycogenolysis and glyconeogenesis will become active, and as a result of that glucose is released into the blood by the liver. Just to sum up these two slides, how the liver will play the role in maintaining blood glucose level. I am repeating the point, how liver is going to maintain the blood glucose level. Very simple. Whenever there is increased blood sugar level, excess glucose will be taken up by the liver and that will get metabolized. When and how that will get metabolized? By the pathway I have told you, glycolysis and glycogenesis. Glycolysis and glycogenesis. Whereas when blood glucose level falls, by the process of glycogenolysis, and glyconeogenesis, and gluconeogenesis, by these two processes, glucose will get formed and glucose is released into the blood by the liver. This is how liver is maintaining blood glucose level. Liver is maintaining blood glucose level or blood sugar level by the uptake and utilization of glucose. Glucose को लेना और उसको utilize करना. First. Second, producing glucose and releasing glucose. Excess glucose को लेना, that is uptake. फिर उसका ग्लाइकोजन में स्टोर करके ग्लाइकोजन को ब्रेक करके फिर से ग्लूकोज मिलाना इज अपटेक एंड यूटिलाइजेशन ऑफ ग्लूकोज. This will be done by the liver. As well as when there is decreased blood glucose level, production of glucose and release of glucose. This process will occur with the help of liver. That was the role of liver. I hope you have understood role of liver. Now role of kidneys. As far as kidney concerned, the role of kidney is relatively very less, minor. It contributes to the production of glucose by the gluconeogenesis. When blood flows through kidney, all the glucose which is present in the plasma get filtered, okay, through the glomerulus, and renal tubular cell reabsorb particularly all filtered glucose, and that glucose get returned into the blood. This is how kidney directly indirectly helping to increase the blood glucose. Does kidney prevent the loss of glucose in the urine? Because renal tubular cells जो होते हैं, they are helping reabsorbing the filtered glucose. Whatever glucose get filtered will not go into the urine, it will get reabsorbed into the blood. That is the role of kidney to maintain the blood glucose level or the sugar. अगर किडनी के सेल ग्लूकोज को reabsorb नहीं करते, तो glucose will get excreted through urine and it will get decrease in the blood. It should not occur. That's why renal tubular cells जो होते हैं वो filter glucose को फिर से blood के अंदर डाल देते हैं. That get reabsorbed into the blood. That get reabsorbed into the blood. That is the role of kidney. So I hope you're getting my point. Role of liver and role of kidney in regulating blood sugar level. Now, third very important system is endocrine system that we have to see, which is maintaining blood glucose level. Before that, liver and kidney दोनों किस तरह से blood sugar को maintain करते हैं, that you have understood. I have told you blood glucose level बढ़ने के बाद में किस तरह से excess glucose will go into the liver, and when this decreased blood glucose level, how the liver will release the glucose into the blood, as well as kidney will filter the glucose, glomerular filtration will occur, and that glucose will not get excreted through urine. That glucose will get reabsorbed into the blood, and when it get reabsorbed into the blood, need not to say the glucose level in the blood get increased. This is how kidney and liver is maintaining blood sugar level or BSL. Now very important, third system, that is endocrine system. Role of endocrines. Most important mechanism for regulating blood glucose level is endocrine system. And need not to say, when we say endocrine, is nothing but the hormones. So there are several hormones. You know very well those hormones. You already studied in endocrine system. Several hormones which affect the blood glucose level. And those hormones are growth hormone. This slide is very important. Growth hormone, thyroid hormone, glucocorticoids, epinephrine, and glucagon. Growth hormone, thyroid hormone, glucocorticoids, epinephrine, and glucagon. These are the hormones more or less maintaining the blood glucose level. Okay. Some of the hormones decreases blood glucose concentration. Some of the hormones increases blood glucose concentration. Okay, like insulin is the only hormone which decreases blood glucose level. Remember well, remaining all other hormones are increasing blood glucose level. Like glucagon, thyroid hormone, growth hormone, increasing blood glucose level, and insulin decreasing blood glucose level. So insulin is the only hormone which is hypoglycemic. Okay. And other hormones are hyperglycemic, like glucagon. So insulin, glucagon, then growth hormone, thyroid hormone, these are all hormones are important to maintain the blood glucose level. As I told you, there are three organ or system which are maintaining blood glucose level. One is liver, which you have understood very well. Then second is kidney. And now third is endocrine system. Endocrine system is, that means hormones, that is growth hormone, then thyroid hormone, okay, corticosteroids, glucagon. See how this hormone maintaining blood glucose level. Growth hormone, what the growth hormone is doing? It decreases peripheral uptake of glucose. Growth hormone क्या करता है? Decreases the glucose uptake, and glycolysis is extrahepatic tissues. So glucose के uptake को कम करता है at the periphery growth hormone. when it decreases the glucose uptake, when it decreases glucose uptake, what will happen? Glucose will not get utilized and the glucose in the blood will get increased. Yes or no? When growth hormone is reducing the glucose uptake, सेल्स और टिश्यूज का जो अपटेक है वो कम कर देता है ग्रोथ हार्मोन, दैट मींस नीड नॉट टू से कि ब्लड के अंदर ग्लूकोज का कंसंट्रेशन बढ़ जाएगा. सो ग्रोथ हार्मोन डिक्रीजेस ग्लूकोज अपटेक एंड देयरफॉर इंक्रीजेस ब्लड ग्लूकोज लेवल. It increases lipolysis in adipose tissue. You know what is lipolysis? Fat breakdown. It increases fat breakdown in the adipose tissues. Okay, fatty acids are used as a result of fuel instead of glucose. Fats break down होके fatty acids मिलते हैं, so that fatty acids will be get utilized for the purpose of energy, and we did not have to depend on glucose for the energy purpose, because every time if we depend upon the glucose for the energy purpose, that glucose will get exhausted, because every time we are not taking the food कि continuously हम खाते रहेंगे और हमको ग्लूकोज मिलते रहेगा. In between two meals, when we are not taking anything, we require the glucose. तो वो ग्लूकोज कहाँ से मिलता है? फैट्स को ब्रेक डाउन करके मिलता है. ये फैट को ब्रेक डाउन करके फैटी एसिड्स तैयार होते हैं और दैट कैन बी यूटिलाइज्ड एज अ पर्पस ऑफ व्हाट यू से द एनर्जी. अदरवाइज क्या हो जाएगा? All the glucose will get utilized, but growth hormone is decreasing. All glucose को use नहीं होना चाहिए, इसके लिए growth hormone decreases the glucose uptake. Growth hormone decreases glucose uptake and glycolysis in extrahepatic tissues. ग्लूकोज को अपटेक करना कम कर देते हैं, फैट्स को ब्रेक डाउन करते हैं, फैट्स को ब्रेक डाउन करके फैटी एसिड्स मिलते हैं, वो फैटी एसिड एनर्जी पर्पस के लिए यूज किया जाता है. एंड व्हेन the glucose will not get excessively used, when excessively glucose use nahi hoga, need not to say blood glucose level is increased. This is how the growth hormone increases blood glucose level. This is how growth hormone increases blood glucose level. Second hormone is thyroid hormones. What the thyroid hormone is doing? Thyroid hormone increases intestinal absorption of glucose. It increases secretion of growth hormone, and this is how, when there is increased secretion of growth hormone, there is increased intestinal absorption of glucose. By these two ways, the blood glucose level get increased. By these two ways, blood glucose level get increased. Next hormone is glucocorticoids. This increases gluconeogenesis and decreases uptake of glucose and glycolysis in muscles and adipose tissue. And by this process, glucocorticoids increases blood glucose level. Every slide is important. Epinephrine acts mainly in the muscles and to smaller extent in the liver. It increases glycogenolysis and decreases glycogenesis. Okay? And that's why blood glucose level get increased. ग्लूकोज का ब्रेकडाउन को कम कर देते हैं. ग्लूकोज का ब्रेकडाउन अगर कम हो गया तो ब्लड के अंदर ग्लूकोज की लेवल बढ़ जाएगी. नाउ वेरी इंपॉर्टेंट हार्मोन इज ग्लूकागॉन. नाउ यू नो वेरी वेल the glucagon and insulin are the hormones secreted by the pancreas respectively from the alpha cell and beta cells of the Langerhans. Okay, so glucagon increases glycogenolysis process and decreases glycogenesis in the liver. Remember well, glucagon increases glycogenolysis, matlab breakdown, and decreases glycogenesis in liver. It increases gluconeogenesis, process by which glucose is formed from the non-carbohydrate sources. So anyhow, glucagon क्या करता है? ग्लूकोज के ब्रेकडाउन प्रोसेस को, जैसे ग्रोथ हार्मोन जो एक्सेसिवली ग्लूकोज अपटेक को कम करता है, and that's why in the blood glucose level get increases. In the same way, glucagon increases glycogenolysis and decreases glycogenesis in the liver and increases gluconeogenesis process. And when there is increased gluconeogenesis process, blood glucose level get increased or raised. Just to sum up till this, what we have studied, that blood glucose level has to be maintained. Initially, what we have studied, carbohydrate food we are taking that get break down into the glucose, that glucose get absorbed from the intestine into the blood, and it will reach to cells and the tissues. That glucose will go into the various metabolic process and will get the ATP or the energy. The excess of glucose which gets stored into the liver, and whenever required, that glucose will get break down and get released into the blood by the liver. This is how, whenever there is a requirement of glucose, liver is playing a role to maintain the blood glucose level. As well as we have studied, along with liver, kidney is also playing a role to maintain the blood glucose level. And beside the liver and kidney, third endocrine system which is important, through the hormones like growth hormone, through thyroid hormone, through glucocorticoids and epinephrine, glucagon and insulin, blood glucose level is maintained. We have already discussed how thyroid, growth hormone, glucocorticoids and epinephrine increasing the blood glucose level. Now I was telling you about the glucagon. Glucagon increases glycogenolysis and decreases glycogenesis, and this is how it increases the blood glucose level. It increases blood glucose level. Insulin is the hormone which decreases blood glucose level. It is a hypoglycemic hormone. What it is doing, it increases glucose uptake in the muscles and adipose tissue. What it is doing, it increases glucose uptake in muscles and adipose tissue. It decreases glycogenolysis and glyconeogenesis. By this process, it decreases the glucose level. It increases synthesis of lipids from the glucose, and thus overall insulin will decreases blood glucose level. Again, I am telling you, insulin is a hypoglycemic hormone. What the insulin is doing? Insulin क्या करता है? Glucose के uptake को by the muscles and adipose tissue बढ़ाता है. Growth hormone क्या करता है? Uptake को कम करता है, इसीलिए blood के अंदर glucose की level बढ़ती है. Insulin क्या करता है? Glucose uptake को increase करता है by the cells and the tissues, and that's why blood glucose level get decreased. ठीक है, सेल्स अगर ज्यादा ग्लूकोज लेंगे तो नीड नॉट टू से कि ब्लड के अंदर ग्लूकोज की लेवल कम हो जाएगी. इंसुलिन इज डूइंग सेम. इंसुलिन इज प्रमोटिंग द ग्लूकोज टू गो इनसाइड द सेल एंड द एडिपोज टिश्यू, whereas ग्रोथ हार्मोन क्या करता है? उसके अपटेक को कम करता है ताकि ब्लड के अंदर ग्लूकोज रहे. ठीक है, दिस इज हाउ इंसुलिन इज प्लेइंग अ रोल. सो लिवर, किडनी, hormones, glucagon, insulin, all together they are maintaining the narrow range of the blood sugar level. ठीक है? So when blood glucose level is low, that is during the fasting condition, secretion of hyperglycemic hormones will occur. फास्टिंग कंडीशन में क्या होता है? हाइपरग्लाइसेमिक हार्मोन्स जो होते हैं वो एक्टिवेट होते हैं, एंड दिस हाइपरग्लाइसेमिक हार्मोन्स लाइक थायराइड हार्मोन, ग्रोथ हार्मोन, कॉर्टिकोस्टेरॉइड्स, एपिनेफ्रिन एंड ग्लूकागॉन, all together these hormones will get activated and they will increases blood glucose level. Whereas when blood glucose level is higher, excess, ज्यादा खाना खाने के बाद में, for that matter, secretion of insulin will occur by the pancreas and that will increases the blood glucose level, and thus blood glucose level is maintained within the normal range. Thus blood glucose level is maintained within the normal range. So in short, blood glucose level is maintained with the help of liver, kidney and hormones. We have already discussed in detail how liver is maintaining excess glucose by storing, and whenever requirement, that stored glucose get break down and released into the blood by the liver. That is role of liver first. Second, by kidney, the glucose which has been filtered by the glomerulus, that by the renal cell or by the tubular cell, that glucose get reabsorbed into the blood and get increased. Then we have discussed growth hormone, thyroid hormone, corticosteroids, glucagon, all these will increases blood glucose level and decreases uptake of glucose by the cell, whereas insulin will increases uptake of glucose by the cell, and when uptake of glucose by the cell get increases, blood glucose level in blood glucose level get decreases, or sugar level in the blood get decreases. This is how liver, kidney and endocrine system maintaining blood glucose level in the normal range. The regulatory mechanism, when get fail, pathological condition will occur, and that will result into hyper and hypoglycemia. Hyper and hypoglycemia. That is hyperglycemia, what we commonly known as diabetes mellitus. So whenever this regulatory mechanism by liver, kidney, hormones, insulin, glucagon get fail, this will result into the hyper and hypoglycemia. Hyperglycemia is more common than hypoglycemia. Hyper is increased and hypo is decreased glucose level. So hyperglycemia is more common. Hyperglycemia is more common than hypoglycemia. Okay, hyperglycemia is what we call as will lead to condition called as diabetes mellitus. You should remember कि जब liver, kidney और hormones blood sugar level को maintain नहीं कर पाएंगे, तो then the regulatory mechanism get fail. जब ये regulatory mechanism fail हो जाएगी, that will lead to pathological condition, what we call as a diabetes mellitus. The most common cause of hyperglycemia is diabetes mellitus. Right now I have told you. Diabetes mellitus may cause because of deficient secretion of insulin. Basically, insulin तैयार नहीं हो रहा होगा, or insulin is not responding to the receptors. That may be the cause for the diabetes. Less common cause is hyperpituitarism, hyperthyroidism, Cushing syndrome. तो बेसिकली पैंक्रियाज इंसुलिन तैयार नहीं कर पा रहे होंगे, या insulin is not responding to the receptors. That may be the cause for the diabetes mellitus, and depending upon that, you know, there are two types of diabetes mellitus: insulin dependent diabetes mellitus and insulin non dependent diabetes mellitus. That is another topic. Right now we are just discussing how with the help of liver, kidney and hormones blood glucose level is maintained. Hyperglycemia is more common than the hypoglycemia. Hyperglycemia is because of diabetes mellitus, and diabetes mellitus is because of deficiency of insulin. Pancreas unable to produce the insulin, or insulin may produce, but receptors are not responding to the insulin to perform its function. And depending upon that, there are two types of diabetes: insulin dependent diabetes mellitus and insulin non dependent diabetes mellitus, IDDM and non-IDDM. Hypoglycemia is most frequently due to, of course, accidental overdose of anti-diabetic drugs to diabetic patient, and it is less common causes like Addison's disease and several liver disease. Diabetes mellitus is the most common disorder of blood glucose regulation. When blood glucose regulation fail, will lead to diabetes mellitus. The main culprit is insulin, and the regulatory mechanism, liver, kidney and hormones are unable to regulate the blood glucose level. Okay? Most diabetic cases can be diagnosed by measuring fasting blood glucose level. Fasting blood glucose level से हम diagnosis कर सकते. Another conventional test by which we can diagnose the diabetes mellitus or the regulatory mechanism of blood glucose level is glucose tolerance test, that is GTT. That is again another topic. We will not go in much detail about it. Okay. One must know about the normal range of the glucose. Fasting blood glucose within normal range, you should know. Blood glucose level rises to 130 to 140 milligram per dl an hour after ingestion of glucose. Okay? It returns to fasting level. It returns to fasting level within 2 hours of glucose ingestion. Okay? Glucose is not present in urine, in any urine sample. Why? Because kidney is reabsorbing the glucose into the blood. So glucose is not present in any urine sample. In diabetic subject, fasting blood glucose is often above normal. The rise in blood glucose after glucose injection is excessive. Blood glucose does not return to the fasting level in 2 hours in diabetic subject. I am talking. Okay. So we will not go in much detail about few other tests and all those. There is one more very important test, glycosylated hemoglobin, which has to be done to check whether there is a control of diabetic is adequate or not. That is glycosylated hemoglobin. So we will not go in much detail of that also. So I hope you have understood how the blood glucose level is maintained with the help of liver, kidney, and endocrine system. In endocrine system, you should remember glucagon and insulin. Glucagon increases blood sugar level and insulin decreases blood glucose level. Thank you very much. Thank you one and all.